Well, I had an extraction, my tooth taken out. And since my wisdom teeth are not in yet, so I gotta get it put back in so it straightens my teeth out.
Raul came in, he lost his tooth. We had to take out his tooth because it broke down, fractured, had decay, so we had to take it out. And now we're ready to place a dental implant to replace that tooth.
Raul has some preconceived ideas about his implant procedure.
There's gonna be a little pain, but not much. It's just wanted to go quick, just in and out.
Okay, what we're doing is we're gonna make a small incision in his gums so we can open it up and actually start to see how much bone he really has. Now the gums are open. That's what we call reflected. And now we're able to start to prepare the site for the implant. How are you doing, Raul? Doing okay?
Mm-hmm.
Let's take one check x-ray.
The check X-ray allows the doctor to check the progress and placement of the implant.
Basically placing the implant in. It gets its primary stability through screwing it in, kind of like a screw in a bone. But ultimately, and long-term wise, the stability is not based on the screwing action stability. It's based on the fusion with the bone and the implant itself. Now we're putting the sutures in. As we open the gums, I want to be able to close it up as well. We use different types of sutures, and in this case, we're using a suture or stitch that dissolves on their own in about a week or two. So we have to get the hassle of coming back and actually taking it out.
After cutting the gums, drilling in the bone, and stitching it back up, let's see if Raul had any pain.
No pain at all. But they numbed everything how they're supposed to. No pain, no nothing.
And voila, we can take an x-ray now.
It was pretty easy. I thought it was gonna be a lot longer. No time at all, easy.
Looks perfect. And we're gonna be in good shape. Good. We're gonna go over some post-operative instructions and then give you some prescriptions, and we'll talk about that as well, okay?
All right.
Beautiful.
I was treated years ago in another office with a doctor that apparently didn't do the right job. And now I am here to do an implant. And since I find a very professional doctors, I decided to come to this office.
Okay, little juice. Abner's a healthy male patient, and he came to us with a missing tooth. In this particular case, the tooth was extracted as a result of a failed root canal and a fractured tooth. You got plans for the weekend or no?
Uh-huh.
We're coming back to place a single implant to basically fill that void. That's it. The worst is over. If you can tolerate this, the rest is easy.
I read some articles, and I think that this is the most appropriate thing to do because it's a procedure that will enable you to feel comfortable 100%.
Wow, you have beautiful bones. The reason we didn't do a bridge in this case, even though he has a history of dental work, is because when you actually remove crowns and play with old dental work, you could hurt those teeth and wind up with a bigger problem later on. So we're still friends, even after all this. Okay, good.
If I would have told that there was an option to do an implant, I would have done it years ago. But since I didn't receive that option, I just waited to the right time, and I think that now is the right time to do the implant.
We're basically going ahead now. We're gonna see where the best place to put the implant is. We're gonna place it equidistant from the roots and make sure it's in a perfect location for the final crown.
I am not nervous because the simple reason that I'm in a professional place, and I know that whatever they are going to do, it will be in a professional way, and I feel very comfortable to do that.
Perfect. It's exactly where it's supposed to be. Alvin, you okay? Mm-hmm. No problems at all, right? Mm-hmm. All we're doing is changing the dimensions of the drill. It's kind of like being in Home Depot. This is the last pin that I check to make sure everything looks perfect. And if it is, then we put the implant in.
To have back your teeth, it's a pleasure to do it.
Okay, next step. Let's put the implant in. You can see he's got some crown work, he's got some big fillings. And the nice thing is if we don't have to touch those, and again, you can see this very, very clean procedure. Nothing bothers him. The implant is in. You're getting a great result.
I was expecting pain because I knew that it's going to the bone, but I was very surprised there was no pain at all, zero pain. And I am very, very satisfied. The whole procedure from A to Z went very, very smoothly. And it, as you see, it was done very professionally. In other words, if I would have known that the procedure is so great, I would have done it years ago.
This show is meant to bring you information, to educate you as patients and consumers as to what options are out there and the best treatment choice that will last you a lifetime.
The alternative of using a dental implant might be the best solution from a financial aspect and from a health perspective.
Dental implants can be the most cost-effective method and treatment option if done at the right time, which is probably now. Are there better options to doing that root canal or to saving that broken tooth? And the answer is you may be a candidate for a dental implant and not know it.
We've been doing this for many years and we're leaders in our specialty, and we do specialize in dental implants and gum disease and gum surgeries. But whoever is going to see you for whatever problems that you have in your mouth, make sure you do ask those questions, whether a dental implant might be the best choice or some other option as a best choice. Whatever it is, keep informed and ask for the best advice, no matter who you go to or who you're going to see.
Just because you're spending time and money in a dental chair doesn't mean the tooth has a good prognosis. And that's one thing a lot of patients don't ask, and they should ask, is how long is this going to last? Or is this going to last a lifetime? Or when will this break down again? So you have to not only ask the questions, but you have to feel comfortable asking those questions. And that's what people in our practice or patients in our practice do, is we make sure we educate everyone and explore all those options with you. Doesn't matter who you use. Just make sure you ask good, educated questions. Because you deserve to be comfortable, you deserve to be happy.
Did you know that today there is a healthy, permanent solution for patients who want to restore their ability to eat, speak clearly, and bring back the natural beauty of their smile? Dental implants could be the solution and are frequently the best treatment option for replacing missing teeth due to trauma or dental disease.
Dr. Wang, myself, and our staff are dedicated to helping people.
You stay well. At Southeastern Dental Associates, our professional staff is ready to consult you and your personal dental situation. Whether it's for a routine dental cleaning or a sophisticated dental implant procedure.
We've been doing this for many years and we're leaders in our specialty.
With 4 convenient locations in Boynton Beach, Miami Beach, Pompano, and Jupiter, our doctors use the most advanced techniques and technologies available to ensure you achieve the healthiest solution possible.
Dr. Wang and I are up to date with technology, and we pride ourselves in knowing today's newest and freshest concepts.
With many years in practice, our doctors have earned an outstanding reputation for providing high-quality, affordable periodontal and dental implant care.
I think most patients think there's going to be a lot of discomfort with the procedure, and there really isn't.
Both of them were just very gentle. They were really good.
Honestly, I can't believe how easy that was.
Call today at 877-987-4321 for your free X-ray and personal consultation with Dr. Alex Wang or Dr. Kenneth Rubenstein to see if you are a candidate for a dental implant. For more information, visit our website at floridateeth.com and take the first step to a happy, healthy smile.